The first three data points there are basically the high-risk areas on the Larimer County dashboard. So if you go to larimer.org/COVID-19, there will be a dashboard of COVID risk factors. And there are metrics like percent positivity, hospital capacity, and they're assigned a risk score, very high risk, medium risk, or low risk. And these three categories are where we currently sit on a high risk on that dashboard as a county. We've had 61 cases and positive cases in the last 24 hours. We've had, for the last 2 weeks, every single day has had more than 15 new cases. And our 14-day case rate per 100,000 is hovering around 360, 380. So that's important for a number of reasons. It's much better than the 800 or 900 we were seeing back in November, but it's still too high. So probably the most impactful for our business community is that 14-day case rate per 100,000 metric. So before our Level Up certified businesses, and Level Up is a program that allows our businesses to operate at one level less restrictive than the overall county level, before they're allowed to move to level yellow, and we're in level orange right now, and it's very confusing, but basically the distinction is you can be at 25% indoor capacity under level orange and 50% indoor capacity under level yellow. So it makes a big difference for our facilities and our businesses that rely on that indoor capacity, like bars and restaurants and theaters. So in order for them to move from that 25% to 50% capacity with those extra precautions under the Level Up program, that case rate has to be below 350 for 7 consecutive days. So right now, it's not safe enough in the state's eyes or in the county's eyes to make that change. So our restaurants and our bars and our theaters are operating under that 25% capacity. And we'll talk about the financial impacts on businesses a little bit later in the presentation under the small business assistant. But it's worth noting that that is the key number for that area. Across the county, we've got almost 17,000 cases. 417 of those are in Estes Park. And when I say in Estes Park, they're in the Estes Park zip code. So the county codes cases to zip codes, not to incorporated boundaries. So that 417 expands beyond just the incorporated boundaries of Estes Park, basically up to Glen Haven and Drake, who are counted separately. There's been 182 deaths in Larimer County. Almost 50% of those happened in November and December. So those were not good times for the pandemic in Larimer County. And 10 deaths in Estes Park. It's worth noting that half of those deaths in Estes Park came from assisted living facilities. And that is a trend that we've seen across the state and certainly across the county. There are a high percentage of the COVID fatalities are coming from assisted living facilities, which is why they were moved up in the vaccine phasing to try to save as many lives as possible. We only have one active outbreak in town. There's been 10 resolved outbreaks since March. You can find all of that detailed information at larimer.org/COVID. They've got a dashboard and it has a lot of great information, and you can go and pick up all of those statistics and breakdowns that I've just reviewed there. Vaccines, this is probably the hottest topic right now, or certainly the one that we're hearing the most about. So I'll take a minute because there is some confusion about, what's the town's role in all of this? It differs from state to state, but in Colorado, most communities, most towns do not have public health departments. The public health function is fulfilled at the county level and the state level. So you have the Colorado Department of Public Health and Environment, and you have the Larimer County Department of Health and Environment. So the state is receiving vaccine doses. They get, right now it's roughly 70,000 vaccine doses a week, which is not enough. Colorado has a much higher population than that, but that's the supply they're getting now. They're hopeful that they will begin to start getting more vaccines as the kinks get worked out of the vaccine distribution program on a countrywide level. But right now there is a supply issue at the state level. So they've created a phasing system with the explicit goal, number one, of saving as many lives as possible, and number two, of ending the pandemic as quickly as possible. So to do that, they distribute doses to providers. So that's UC Health, Banner Health, Estes Park Health, Salud. they distribute, providers is, I got those mixed up. Providers is doctors and personal health providers, health systems, UC Health, Banner Health, Estes Park Health, local health departments. So they'll get some vaccines. They haven't been getting a lot. Most of the vaccines have been coming directly to the providers. And then some pharmacies are also receiving vaccine. Each one of those categories has a different mechanism to distribute their allocated vaccines. So if you're a UC Health patient, they have a system where when you're eligible for it based on the information that they have on your electronic file, they will contact you and say, hey, you're eligible for the vaccine, make an appointment here. Locally, Estes Park Health is looking at setting up a similar system where you can be notified when you're eligible for the vaccine. Right now, and we'll talk about phases in a second, but right now it's not as impactful because the state as a whole and Larimer County are still moving through the first phase and a half. As we move into the second half of the first phase and start talking about everybody over 70 or over qualifying for the vaccine, that's where it becomes much more impactful to make sure that all of our providers are able to connect to people who are eligible, and anybody who is eligible has the opportunity to receive the vaccine. So, as I mentioned, there are supply challenges at the state level that impacts distribution overall. So the state is in charge of distributing those. They're making the decisions on where these vaccines go, who gets what, and how much is distributed to what geographic areas. I will say that on an overall standpoint, Colorado is doing a very good job of getting vaccines that it receives out and into the arms of the public. So the last time I checked, we were fifth, and we were the most effective in states that received over 400,000 vaccines. So the numbers at the state level, you have almost 300,000 people have been immunized with one dose and an extra 55,000 that have been immunized with 2 doses. So really a drop in the bucket in the 5 million plus residents we have in Colorado, but they're moving in the right direction, and they've proven that they can get those vaccines out if they could just get more from the federal government. We are working with Estes Park Health, the town is, on facilities and logistics for a possible vaccine clinic when Estes Park is able to move into the 1B category. And I'll talk about the phases in a second here. That's really what the town can do to help facilitate resident access to vaccines. We work with the county, we work with our local providers, and we try to support them wherever we can and use our resources wherever we can. So you can get general information about the vaccine from the state, and I can send these slides to Kathy afterwards so you don't have to write down these addresses. But the state has a lot of great information. They've got a dashboard that you can follow how many people have got the vaccine in Colorado. You can look up specific data on the vaccines. You can link to the CDC. The second one is really important. If you are over 70 or over right now, you can go to larimer.org/COVID-19. There is a vaccine link on there. It's the second or third link down on the right side. And if you click on that, it'll take you to a form for those who are 70 or plus to sign up with the county. So even if you're signed up with a provider, you can also sign up with the county, and they'll make sure that when you are eligible for the vaccine as someone who is 70 or older, they will make sure that you can get connected to a provider. So they have an internet form that you can fill out. It's really simple. It shouldn't take much time. And they also have a wealth of information about the vaccine and the most local information for Larimer County. So this is changing almost every week. So caveat presented, this was revised at the end of December. This may change depending on the state's supply and their priorities. But they do have 3 phases right now. The first phase includes 2 sub-phases. They're almost done with 1A, both in the county and across the state, which is the highest risk healthcare workers, the people who are working directly with COVID patients and our assisted living facilities, because we know that the fatality rates, the morbidity rates are so high in those assisted living facilities. It was really a priority to get those vaccines into those long-term care facilities. The second, 1B, so a few weeks ago, the governor included Coloradoans aged 70 plus in that category. So that was a significant expansion of that 1B category. They expect to start in on that category probably the first to middle part of February, and then, it'll continue through March at the very least. So you see phase 2 is the higher risk individuals and other essential workers. Again, this slide and flow charts can be found on the state's website. That phase is targeting people who are 60 to 69 years old, anybody with those pre-existing conditions that we know make people more vulnerable to having severe COVID infections, and other essential workers. So a lot of our workers will fall in this phase. Our light and power folks, our water folks, they'll all fall in phase 2. The only town employees that were able to access in phase 1 were police officers and our dispatchers, those frontline first responders. And you'll note also in phase 1B, essential frontline journalists can access. So they're really looking at folks that have the most impact or most contact with the public for their job, grocery workers, transit workers, things like that. And then lastly, at the start of summer, hopefully it'll be open to the general public. Anyone that doesn't meet any of the preconditions in phase 1 or phase 2 will be able to access in summer of 2021. So we do right now have 2 approved vaccines. That's the Moderna vaccine and the Pfizer vaccine. They are both 2-dose vaccines. So the first dose gives you some immunity, but not much. And the second dose gives you the 95% efficacy. They are getting closer with a number of vaccines that are 1-dose vaccines. So there's a chance that if any of those are approved by the FDA, it could change these timelines by changing the supply. So this phasing is very fluid. It changes frequently depending on the data the state is seeing. And the best place to stay in touch and get those updates is that state website. They post the most up-to-date information. One note, even when folks get the vaccine, the county and the state and the federal government are still asking people to wear masks and respect social distancing. There are a lot of reasons for that, but probably primary among those is that until that community transmission decreases, those are very effective interventions layered on top of vaccines. There's also, at this point, there's not pure clinical data that shows that somebody who has the vaccine can't infect somebody else who may not have had it yet. So there's hope that that is the case, but there's not the evidence to prove it. So they're exercising caution until that community transmission really drops down and they're able to trace all of the cases again. So before I move on to the next item, I'm happy to answer any questions you might have or point you in the direction of information if I don't have it.
Travis, we were going to kind of skim and read the questions, but I'm going to suggest you just open chat and look through them and talk.
Okay, let me see if I can find that.
Do you want me to just read them?
I might just need a second to find the chat box. That's not a problem. There it is. All right, I will start at the top and just work my way down. Does the case rate need to be 350 for all of Larimer County, or can Estes Park separate out from it? No, that does need to be for the entire county. That case rate is required to drop below the 350 for the entire county for 7 consecutive days before those level up certified businesses can move